This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, and thank you for joining us today for our Healthy webinar series. Today's webinar is Healthy Spine for a Healthy Life. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We'll answer as many questions as we can within the time allotted once the presentation concludes, and your questions will remain anonymous. Today's presenters are Dr. Ben-Eliyahu, Caitlin Conville, and Susan Prechtel-Loper. Dr. Ben-Eliyahu is the Administrative Director of the Back and Neck Pain Center at Mather Hospital and Director of the Mather Chiropractic Collaboration Program. He has advanced certification in sports injuries and pain management. And Dr. Ben-Eliyahu has been in private practice in Selden, New York for 34 years, where he directs an integrated and collaborative spine and musculoskeletal practice. Caitlin Conville is a nurse practitioner and program coordinator for the Back and Neck Pain Center at Mather. She received her Master of Science from Stony Brook University after completing their family nurse practitioner program. She joined the Back and Neck Pain Center from the inpatient side of Mather Hospital, where she worked in orthopedics for over 4 years. Susan Prechtel-Loper works in Mather's outpatient physical therapy department. She received her Bachelor of Science in Physical Therapy and her master's degree in healthcare management, both from Stony Brook University. She has worked at Mather as a physical therapist for 7 years. Dr. Ben-Eliyahu, you can go ahead and get us started.
Thank you very much, Emily. So today we're going to talk about a healthy spine and how that helps you have a healthy life. Advance, please. So just a little bit about back pain for those who haven't heard us speak before. 85% of all people in the United States will develop a back problem sometime in their life. That's not to say that 85% of our population currently experiences back pain at any one given moment. Actually, that's about 31 million Americans. Low back pain has become the single leading cause of worldwide disability. This has been published in Lancet, which is a very prestigious medical journal. That's pretty significant. In fact, Americans, actually individually Americans, spend almost $50 billion a year on back pain treatments, which ranges from pretty much everything. The total actual expenditures in the United States for back pain related expenses, that includes insurance companies and disabilities and lost productivity, is actually approaching almost $200 billion now. Excuse me. One of the biggest things about back pain is the rate of recurrence. Back pain can recur usually with 50% of the time within a year and 60 to 80% of the time within 2 years. And that generally happens because whatever is causing that particular problem is not addressed. The inflammation goes down, some of the muscle spasm goes down, the symptoms abate a little bit and get better, but then it comes right back again because whatever risk factors there were and whatever contributing factors there were weren't addressed. And we're going to talk about some of those today. Next slide. So the effects of chronic back pain, back pain can lead to many other medical problems too. This has been well researched and well published. So for example, chronic back pain due to inactivity can certainly lead to weight gain, and then of course depression as well. And there's a very large correlation between anxiety and depression and chronic back pain. In fact, published literature shows that about 30% of chronic back pain patients will actually develop depression and anxiety. And then we develop this vicious circle. You're depressed, you're anxious, you don't feel like doing anything, so you aren't active, you don't exercise, you gain weight because you're very sedentary, and then it just becomes more depressing. So there's a vicious circle. So depression can also cause sleep disorders. And if you're not getting enough sleep, or you're not sleeping well, certainly sleep deprivation or sleep issues can also cause muscle problems and back problems. And there's another contributing factor. So this is also a contributing factor to why chronic back pain can become chronic, because it develops sleep disorder. Sleep disorder causes more back issues, another vicious cycle. Obviously, sleep disorders is much higher with people with chronic back pain, and certainly weight problems and high BMI based, body mass index can also contribute to back pain because of the increased weight, how it affects your posture. It affects your ability not to exercise or not want to exercise. You can develop hypertension and heart disease. So chronic back pain has been shown to actually be in a very high prevalence and associated with people who get hypertension and heart disease as well. So obviously getting rid of chronic back pain is important for a lot of reasons, not just from a pain perspective, but from overall general health perspective. Next slide. So what are some of the risk factors that I mentioned before that can perpetuate back pain, that can cause back problems? And they include, like we talked about, anxiety and depression. And we're going to give you some tools later that Caitlin's going to talk about to help that. Physical activity, we talked about that. And this goes to both ends of the spectrum. Too vigorous an exercise, people who are doing too much can injure their joints, can cause muscle spasm, damage their joints in their lower back. So, and then of course, none on the opposite side of the spectrum allows muscles to atrophy, allows you to gain weight. And these are contributing factors for bad backs as well. Poor posture, part of everyday life. So when you're sitting, sleeping, standing, it's really important to pay attention to your posture. So you want to sit erect, sit at the edge of your chair so that your pelvis is nice and tight. Bring your core in a little bit and have your head directly centered over your back. And that goes for sitting, it goes for standing, because every 2 inches that you allow your head, now here, I'm kind of looking to the side, but my head is centered right over my spine right now, which is good posture. If I were to do this, my head just shifted about 2 inches past my midline. For every 2 inches that your head goes forward, it's as if you just took a 20-pound weight and put it on top of your head. Imagine walking around with a 20-pound weight on top of your head all day long. That's going to cause not just neck problems, it's going to cause shoulder problems, and it's eventually going to cause back problems as well, because gravity with that weight just forces everything down. So posture is extremely important. Suboptimal diet, and that ranges from eating junk food and eating foods that are pro-inflammatory, that don't optimize health, can lead to weight gain, which can lead to back pain. So we're going to talk about diet as well, and nutrition and the importance of that. We'll talk about smoking. Smoking causes decreased blood supply, which affects your back from the point of not getting proper circulation. We mentioned obesity, and we mentioned medical comorbidities. Hypertension, diabetes, osteoporosis are all medical problems that kind of want to make you sedentary and not exercise, but it just fuels the fire. You have to exercise, you have to be active. And we'll talk about that. Next. So what are some common reasons? We'll just briefly go over some of the anatomical reasons of why people get back pain. The top left-hand picture, we're talking about the joints. What's circled are the facet joints. And the facet joints are joints that allow our spine to move in each direction, rotation, bending, side bending. And as a result, if those joints are improperly loaded or they're fixed and they're not moving properly, it can cause back pain. Another reason for back pain in the middle is what we call radicular pain, or another word is sciatica. That pain goes right down the leg. Many people get sciatica. I've personally had it, and it's not a pleasant feeling. And that's due to usually a pinched nerve in the back, most commonly from a slip disc or a herniated disc. If you look at that middle picture where it says bulging disc, you can see the disc that sits between the vertebrae. It's almost like a jelly donut. The jelly that sits normally in the middle actually protrudes to the side to where the nerve is. And as a result, that nerve gets pinched and it contributes to the leg pain or the radicular pain that goes down the leg. Another reason is muscle injuries. Here's a classic one called the piriformis syndrome, which can actually cause sciatica pain down the leg too. And you can see the pointer is pointing to the muscle across the buttock area. That muscle sits right on top of the sciatic nerve. If that muscle goes into a spasm, it can actually cause pinching of the nerve. Another reason is sacroiliac joints. Now, this is actually pretty common and often underdiagnosed. The sacroiliac joint is a joint in the pelvis, and there are one on each side of the right and left side of your pelvis. And a lot of times, people who've had back surgeries, in pregnancy, people who bend over quickly, that joint can get misaligned, it can get stuck, it cannot move properly, become inflamed, and send pain signals that can replicate what some people think is a pinched nerve in their back. So these are all common reasons. Next slide. So let's go over some lifestyle tips. And by the way, as I go over this quickly, we're going to go over each one of these in specificity and more detail. So we're just going to kind of briefly touch on it now, but you'll get a copy of this particular PowerPoint with all the notes that are here. So you don't have to take notes. Just listen for now. Emily will send this to you, all the attendees later. So obviously we're going to talk about ergonomics, like how to bend and lift correctly. If you're not doing that properly, it can cause issues with your back. So this is an everyday lifestyle thing you want to get used to doing. You want to develop a good sleep pattern. You want to get a good night's rest. That's when your body heals. So anything that you did during the day, if you're sleeping a solid 7 to 8 hours a night and you're sleeping in the right position, it's going to help your body and it's going to help prevent back pain. We talked about posture. Sitting is now called the new smoking. Everybody sits way too long, and sitting increases the pressure in your joints and your discs by 6-fold as opposed to standing or laying down. So if you're sitting 8 hours and then you're slouching with your head forward looking at a computer monitor, or what we call a text neck now, where you're texting all day long, it's going to put a 20-pound weight on your head and it's going to cause pressure in your back and your neck. So if you're going to text, if you're going to work on a computer, make sure your posture is nice and erect, and then take breaks. Change your shoes. We're going to talk about the relationship between your feet, the shoes you wear, and your back. There's a very significant relationship there. You need to stay active like we talked about. Don't smoke. Smoking causes back pain due to decreased circulation. If you're smoking now, do everything you can to try and quit. We're going to talk about the role of stress in causing back pain. Stress is an everyday part of life. You know, we encounter stress from the moment we're born to the day we die. It's not about eliminating stress, because you can't eliminate stress in life. Life is stressful, especially this past year. So it's about learning how to ameliorate or mitigate that stress through different techniques. And one of them is exercise. Another one is meditation. And Caitlin's going to talk a lot about that in a few minutes. Stay hydrated. Our body's 80% water, and yet most of us just don't drink enough water. And coffee doesn't count. Coca-Cola doesn't count, for a couple of reasons. One, coffee is caffeinated. And I'm not saying don't drink coffee. You know, limit yourself to maybe 1 cup a day. But some people think that no matter what fluids they get in, it replaces water, and that's just not the case. And since our bodies depend on water and our discs are 80% water, we need to rehydrate to keep our spine supple. Work smart, pay attention to ergonomics. We'll talk about that, and then we'll talk about some warning signs. Next slide. So talk about lifting. You can see in this diagram, you can see how that person on the left is bending at his hips and he's kind of leaning his whole back over. Well, he moved the center of his gravity from the midpoint of his back over to where that weight is. So as that weight comes up and that person tries to lift up, what happens is it now puts all the stress at the midpoint of that mid-back curve, because that's where the gravity point is. So that's not the way to stretch. That always results in back pain eventually. Now, if that person that bent forward also happened to twist and bend to his side, that would also cause a significant predisposition to injury, because not only did he just lean his center of gravity over where the weight is, he now twisted his disc, which can cause disc injury. Torsion and twisting is one of the biggest factors for disc injuries. So now look at the good picture where the person bent at his knees. He bent down, he lifted the weight with his arms, and then he used his knees and his thighs and his leg muscles to drive upwards. That's the best way to do it. Next slide. So proper sleeping posture. So notice on the right, there's a big X about sleeping on your stomach. So why is sleeping on your stomach bad? Well, for 2 reasons. One, that person's neck is now completely turned to the right. As a result of it being turned to the right, he's stressing his neck muscles and his neck joints. He's going to wake up with a neck ache in the morning at some point. The other thing that happens is look at the red dots of the spine. When you lay on your stomach, our weight in the middle makes our mattress kind of sag in the middle, and that puts our spine into a hyperextension, increased curve. That causes pain. If I were to take my pencil and I kept bending my pencil, it's going to snap and break in the middle. And it's the same situation here. So the best place to sleep is on your, in my opinion, is on the side. Put a pillow between your legs if you're having some back discomfort. Bend your knees a little bit in the fetal position, and then look at the pillow by the person's head, how his neck, his head, and his spine are almost in like one line. Excuse me a second. So on the bottom picture, the person's laying on their back, and same thing. Their spine is nice and in line with their neck, and then they put a pillow underneath their knees to keep a little stress off their lower back. That's the best way for you to sleep, and those are really good positions. Next slide. So what about posture and back pain? So posture, like we started to talk about, is really important when you stand, when you sit, and just as I just showed you, when you sleep. So notice in this first picture on your far left that the person is actually stooping forward as I described. So his head is forward, his upper back is forward, and he's leaning to the point where there's actually stress on the upper back. So his head is shifted forward about 2 inches as well. So this person is going to end up with upper back pain, eventually lower back pain, but certainly neck pain as well, because remember, for every 2 inches you let your head shift forward, it's going to cause back pain. The middle picture talks more to the lower back. So when you allow, like picture this person having kind of like a pendulous belly. So as that belly goes forward, the spine goes backwards, and that creates this hyperlordotic or sway back deformity, which allows stress on those lower back joints. So again, belly in, shoulders up, head over the spine, much better picture, kind of like the guy on the right. Next slide. So sitting all day, we talked about how sitting is kind of being considered the new smoking. So when you sit all day, obviously, and your head starts to shift forward, your neck's going to get tense. That's why people are always doing this, because as you're sitting forward, your shoulders become very tight. That's the trapezius muscle. The disc in your lower back can actually bulge, because the more compression downwards on the disc, the more pressure there is. Knee pain can develop from sitting too long. And it can cause a whole host of mechanical musculoskeletal problems. The best way to sit is look at the picture number 2. See how the spine is nice and straight. The thighs are perpendicular to the calves. And I like to tell people to even take like a small pillow or take a towel, roll it up and put it in the lower back, and then put a little step stool under your feet. So that kind of promotes really good sitting posture. Next slide. So the role of feet in back pain is well established. Most people don't know this, but if you have hyperpronated or flat feet, it can actually promote back pain. If you look at the picture on the far left where it says before and unsupported, it's a graphic, exaggerated picture, but the guy's left foot is actually rotated inwards. It's called pronation, and it causes some flatness of the foot. But the problem with that is it now changes the whole foundation of your skeletal structure. Notice how the knee buckled in. Notice how the pelvis dropped to that rotated side. Notice how now the spine has tilted, and notice how the neck and the shoulders are now tilted. So over time, what'll happen, because of flat feet or hyperpronation, it can contribute to muscle weakness. It can contribute to structural malalignment, which obviously will eventually lead to pain. So the picture on the far right is if someone has hyperpronation or flat feet, by simply putting a custom-made orthotic design for your own foot, it takes your foot from being rolling in and flat to the neutral position to promote the after picture, which is what we want, which is well-balanced foundation, a well-balanced skeletal structure, and then a happy harmonic muscle system that's actually supporting the spine the way it's supposed to. So if you have flat feet, if your feet are pronating, you can kind of look at that top right-hand picture, if that's what your feet look like. If you don't see an arch when you're standing, it doesn't matter what it looks like when you're sitting. It matters what happens when you're standing. If your foot goes really flat or you see your ankle rolling in like that far left foot there, then you're a pronator and you need to put something in your shoe, especially if you're experiencing back pain, ankle pain, knee pain, hip pain. Those are definite contributing factors. Next slide. So the physical therapist will talk about core exercises and the stability of the spine. Core stability exercises are critical for preventing back pain and not experiencing any issues with your back from daily activities of living. We all take care of our teeth. We brush our teeth, assuming you do. We brush our teeth, floss our teeth, use mouthwash, water floss. Those are all things that we do pretty instinctively almost every day. Nobody pays attention to their back, yet 80% of the population will have a back problem at some point. Just by doing some simple core stability exercises keeps your core strong and can actually prevent your back from getting bad and having an injury. Simple things like dead bugs, semi-sits, just doing planks, and hopefully the physical therapist will talk about this in a bit. Next slide. So now I'm going to hand this over to Caitlin. She's going to talk about some other risk factors.
Right. Hi, everyone. I'm Caitlin Conville. I'm the nurse practitioner at the Back and Neck Pain Center. And I'm going to talk to you a little bit about smoking. So everyone knows that smoking is an unhealthy habit that can cause damage to our bodies and lead to lots of long-term health complications. And this includes cancer, COPD, heart disease, and diabetes, among many others. But smoking can also contribute to back pain. So like Dr. Ben said, smoking can lead to constriction of blood flow in the body, which damages ligaments and muscles, as well as our blood vessels. And this is why heart disease is common with smoking. So this reduced blood flow can also affect the discs in the spine, and it can increase healing time if there is an injury to your disc. Overall, smoking can cause inflammation and impaired immune function in the body, and this can increase back pain and can increase healing time if you do have an injury to your back. Quitting smoking is the best thing you can do. It can both decrease the risk of developing back pain and it can reduce the overall severity of pain. Quitting smoking also decreases your chances of developing a long-term illness or cancer, and it can overall lead to an improved quality of life. So there's actually a study that was published in 2016, and that showed that there was a distinct relationship between back pain and smoking. So if you have back pain, if you don't have back pain, but if you're a smoker, stop smoking. If you're interested in resources for that, there is a website with New York State. You can type in New York State, quit smoking on Google, or you can go to nysmokefree.com. They have lots of resources for quitting, and I encourage you to do that right away if you do smoke. Next slide. All right, anxiety and stress. So when your body experiences a stressor, your sympathetic nervous system responds by releasing stress hormones. So these hormones cause physiological changes in our body that have a negative impact on our body. So you can see here on the right some of the effects of this regular experience of stress, and that can include lack of concentration, low energy, headaches, increased pain, depression, suppressed immune system, increased blood pressure and heart rate, joint pain, muscle tension, protein breakdown, decreased bone density, and a change in appetite leading to weight gain, among many others. So with regard to the experience of pain, the experience of psychological stress in particular can have a negative cyclical effect on the body. So here on the left, you can see how psychological stress can lead to pain, as we discussed, which can then cause us to react to that pain with guarding our muscles, which then restricts our range of motion, which can then lead to muscle weakness and atrophy and decreased function, which then, of course, makes us feel more psychological distress. So stress has a big impact on the body, and to have a healthy lifestyle, we want to try to reduce that stress. Next slide. So now that we know some of the ways that the stress affects us negatively, how can we reduce our stress levels on a daily basis? So we have a short list here of just a few things that can help reduce day-to-day stress. First one here is setting a schedule. So by making a schedule, you can evaluate what a doable schedule would look like for you and make adjustments to your activities accordingly. This you can avoid overbooking, overstressing. So this can allow you to carve out time to rest, decompress, get exercise, and practice self-care in between activities. Also, eating a healthy diet can help to reduce stress. Exercising regularly, developing good sleep habits. Sleep loss can make it hard to manage your blood sugar and your stress levels. It affects you hormonally. So we encourage you to aim for 7 to 8 hours of sleep. That helps to keep your blood sugar, your appetite, and your stress at normal levels. Developing a support system, finding people, in your life that you can talk to when you do have stress that, can help you through that stress, always important. Changing your expectations. So it's really easy to get overwhelmed by too many activities, too many responsibilities, trying to do it all. So, trying to decide what gives you what has the most positive impact on your life, eliminating activities that weigh you down, those can all have a positive effect on your overall well-being. And then breathing, meditation, and yoga. So, taking time to stop, to take a deep breath, to try to reduce our stress levels, breathe out the stress and, try to relax. That can be really helpful. So taking out the time for meditation and yoga can really amplify that effect further. You can see on the right here, we have a diagram with body scan meditation. So that's a great practice in addition to yoga that can really help you to de-stress, something to do daily, really easy. You just take deep breaths and try to feel each part of the body from the head to the neck, all the way down to your toes, and to breathe in and really take that time to connect with your body. Definitely has positive effects. Next slide. Okay, so obesity and poor nutrition. So another thing that not everyone thinks about every day is the way in which the size of our body can actually cause back pain. So obesity in America, as we all know, has become increasingly prevalent. The latest CDC statistics indicate that 42.5% of adults over age 20 have a BMI that categorizes them as obese, while 73.6% of adults over age 20 are overweight. That includes those who are in the obese category. So multiple studies have been conducted to study the relationship between back pain and increased body size. And a meta-analysis of these studies found that being overweight or obese was a significant factor in both developing and perpetuating back pain. So as you can see here on the right, when our bodies are a healthy weight, our systemic levels of inflammation are low. We have low levels of mechanical stress on our low back, and the ground reaction force is low. And then as our body size increases, those inflammation levels go up. The extra weight we carry increases the stress levels on our back. And our muscle strength decreases, and then our ground reaction force increases. So these factors all work together to put more strain on the back and to cause or worsen back pain. So we all know that increased body weight can contribute to health problems, including the back pain, but what can we do to reduce that risk? So it's important to not just seek to reduce calorie intake and increase exercise to decrease body size, but it's important to recognize that what you eat matters. So certain foods in our diet can increase inflammatory markers in the body that can contribute to pain and inflammation, while other foods can decrease inflammation in the body. And we're going to go over that on the next slide. So the role of diet and nutrition, on the left here, we have examples of those foods that are not the healthiest foods in the world, foods that promote inflammation in the body, promote weight gain, while providing very few nutritional benefits. So on the right, you see lots of fresh, colorful produce, high in antioxidants, vitamins, and minerals, and these foods all serve to reduce inflammation in the body. Research shows that our diet plays a significant role in inflammation and pain in the body, and it's an important underlying mechanism for the development of chronic disease, including type 2 diabetes, heart disease, arthritis, and cancer. Increased inflammation in the body is also found in patients with chronic pain. So by recognizing the foods that can reduce inflammation, such as plant-based foods, as well as those that promote inflammation, we can make diet modifications that can decrease inflammation in the body and help to reduce pain. So on the next slide here, we have two examples of anti-inflammatory diets. So on the left, we have the food pyramids for the Mediterranean diet and for a whole foods plant-based diet, which are both anti-inflammatory diets that provide excellent guidelines for how to make diet modifications that will reduce inflammation in the body. So inflammation in the body can either be positively or negatively affected by the foods that we eat, as I said. Pro-inflammatory foods, or the foods that tend to increase inflammation in the body, include things like saturated fats, which are found in meat, like red meat especially, and whole fat dairy products. Trans fats, which are found typically in hydrogenated oils, which are usually in packaged baked goods or processed foods or crackers. Omega-6 fatty acids, which are found in oils such as corn oil, safflower oil, sunflower oil, and in sugar-laden foods, so candy and sugar-heavy foods. Whereas anti-inflammatory foods, which help to reduce the inflammation markers in the body, include things including omega-3 fatty acids, which can be found in canola oil and walnuts, monounsaturated fats such as olive oil or avocados, and then fruits, vegetables, and whole grains, and in addition, many herbs, spices, and teas. So these are just some things to, include in your diet, and again, some things that you might not want to include in your diet that can just help to reduce inflammation, help you to have a healthy lifestyle, and help to reduce back pain. Next slide. So what do you do if you do have pain in your back or neck? So this is just a brief guideline of some things you can do at home, treatment options that are available, and times when, it might not be something you want to do at home. So home care can include rest, ice, and heat. We do have treatment options available, conservative care such as physical therapy, chiropractic care, acupuncture, and massage therapy. We have the Back and Neck Pain Center here. We're going to go over some of these options a little bit later in the presentation, just to let you know what is available if you do have pain. But something I just really want to highlight is when you have a red flag, a serious injury, something that really warrants you to go to the emergency room. So these are things to look out for if you do develop pain. If you're having a fever, if you're having loss of bowel or bladder function, if you had a fall or an injury and you think you might have a possible fracture, if you have severe pain after an injury, anytime that you have major muscle weakness, unable to lift your arms or your legs or to use them the way you normally would, progressive loss of sensation, so numbness that is progressing, or severe or unrelenting pain. So those are things that if you do experience those, you definitely want to get yourself to an emergency room so that you can be evaluated right away and get immediate care. Next slide. All right, so now I'm going to hand you off to Dr. Ben Eliyahu, who's just going to review our risk assessment tool with you.
Kaylin. So everybody take a moment now to take a look at this tool that we use, assuming you signed on today because they may have some issues. If you don't have issues, obviously you don't need to do this, but this will give you an idea of how we assess people clinically. We use this functional tool. It's called an Oswestry Disability Index. Most insurance companies and Medicare actually want us to actually record this kind of information to baseline people, and then also use this as a progression tool to see how people are coming along. It doesn't look at pain so much, excuse me, as it looks at function and your ability to function okay. So go ahead and take a minute. We'll give you 60 seconds and just kind of look at it in your head, just kind of check off how many apply to you. And then we'll go over the results in a few minutes and what it means. And for those of you who are watching and kind of looking at the list and checking things off, notice that there's a Q&A section. It's completely anonymous. Just if you don't mind, just for the people that did it, just kind of go ahead and put that number in there, whether it's 2, 3, 4, I think there are 9 boxes. Just go ahead and put the number in there, and we're going to refer to this later so people get an idea of what it means. All right, another 15 seconds, and then we'll move on. Okay, so Caitlin had mentioned that there are 2 non-operative conservative treatment methods that have been proven to help people who do develop a back problem. One of them is physical therapy, and the other one's chiropractic medicine. I'll talk about chiropractic medicine and some of the research behind it, some of the things that chiropractors do in modern day chiropractic care today, and then the physical therapist, if she's on, will go over physical therapy. Next. So I am a practicing chiropractic physician. I practice in Selden. I've been practicing for almost 37 years now. I also direct Mather's spine program. So I'm going to talk a little bit about modern day chiropractic care very briefly. Some of you may have been to a chiropractor, so this might be a review, but I'm still just going to go over a few basic tenets. Next. So chiropractors generally focus on the musculoskeletal system and mostly look at spines and joints. It's a drugs-free, hands-on approach. We do very comprehensive physical exams. We make diagnoses. We use imaging like x-rays and MRIs to make our diagnosis. And then we select evidence-based, patient-centered care programs. Chiropractic care has been well researched in the last 20 years with very significant random controlled clinical trials that have shown that chiropractic care is very efficacious for back and neck pain. In fact, so much so that it's actually been published and recommended as a first-line therapy by these major associations, the American Medical Association, the FDA, the CDC, and even the American College of Family Physicians. It's kind of like if you would ask someone in the AMA 25 years ago, should I go to a chiropractor? I think everybody knows what that answer would have been. That's drastically changed. And, now there have been at least 2 or 3 very well-controlled clinical trials published in the AMA journals that talk about how it's a first-line approach for back pain. Chiropractors in the community, we've vetted them, and they're part of our Mather affiliation program. So there are chiropractors throughout Suffolk County that have been kind of screened by Mather Hospital as chiropractors who do good quality work. And when a chiropractic care approach is selected to be, part of someone's treatment plan or our spine center, we'll recommend one of those doctors. Next. So real quickly, so what do chiropractors do? For those of you who have been to a chiropractor, it's pretty much review, but chiropractors do spinal manipulation and mobilization. We use very commonly low force techniques called the Cox table. You can see the middle picture on the left is actually a tool called an activator or a gun tool. It just creates little clicks over the spine to move the joint very gently and reduce the muscle spasm there for people who are not good candidates to get the standard manipulation. And not everybody is, by the way. Probably if I had to estimate in my practice, I'd probably only do it to maybe 1 out of 3 or 4 patients. I use other techniques, most commonly the Cox technique. The top right picture is someone in cervical traction. We use that for patients with pinched nerves, cervical disc herniations, spinal stenosis, as opposed to doing the high velocity manipulations. And chiropractors tend to do a lot of muscle work and work on massaging and not breaking up the knots in the muscles. And then we use also modalities like electric stimulation. You can see the bottom left-hand picture. We're using infrared laser to help reduce inflammation. And we always talk about diet, nutrition, and posture. Next slide. Here's a picture of the Cox table. This Cox table, the doctor on the top left-hand picture, you can see is actually moving the bottom portion of the table up and down while he holds the spine. And what that does is it flexes the spine and it reduces intradiscal pressure by pumping the disc, but it also moves the joint and it increases the spaces between the bones where the nerves live to kind of unpinch a nerve. Very gentle, very easygoing, and highly effective. The same picture on your top hand right is the same exact table, does the same thing for the neck. So the doctor's right hand moves that headpiece up and down into flexion and extension, and it does the same thing. It very gently moves the joints, pumps the disc, and decreases any intradiscal pressure. I've actually published a paper several years ago looking at how MRI helps to diagnose a particular problem, but also how MRI can be used as an assessment tool afterwards. And we did about a 30-patient study, and you could look on the before treatment picture. That was commonly what we would see. The very bottom circle on your left-hand side, you can see how the disc is sticking out into that white space. That's called a disc herniation. And then after several treatments, usually several weeks later, we would repeat the MRI and you could see what happened to that disc. So a misnomer about once you have a disc herniation, you have it for life is actually not true. Many times that disc herniation, if taken care of properly, can actually decrease in size or completely resorb. So this is a highly effective technique that most modern day chiropractors use today. It's extremely safe. Like the misnomer is, you know, once you go to a chiropractor, you have to go to a chiropractor for your life. That's just not true. Chiropractors are good chiropractors, modern day chiropractors. They want to help identify the problem, treat the problem, get you feeling better, give you the tools necessary to rehabilitate and strengthen the region, and then discharge you to self-care. And then the other misnomer is that, you know, when you go to a chiropractor, everybody gets their neck cracked and everybody gets their backs cracked. That's just not true, because some people it's just not good to do it to. And we utilize techniques like this. And by the way, even if you do like having it done or you do get it done, the noise, nothing's cracking, nothing's breaking. It's just gas that's released from the joint as the joint is separated. Next slide. So is the physical therapist on? Yes.
Yes.
Oh, hi. Okay, so Susan is a physical therapist here at Mather Hospital, and she is going to discuss, you know, how exercise and stretching plays a huge role in everyday activities, and not just helping you to prevent pain in your back or neck, but also if you do develop it, how that's so important helping to make it better. Susan, all yours.
Yes, thanks, Dr. Ben. I'd like to begin with discussing an evaluation of neck and back. When you come to physical therapy, the first thing that is done is a board-certified physical therapist will take the session, usually an hour, to do a full assessment on your spine and your neck. It begins with a range of motion testing of your spine, where we'll look at your flexion, your extension, your rotation, and your side bends, whether it's in the cervical spine, thoracic, or the lumbar spine, and a goniometer and measurements will be taken. Then the second part that we'll do is called the manual muscle test, where we'll strength test the core and the postural muscles in your arms and legs, depending on what the therapist may be finding as they're moving through on that physical exam. Then we'll move on to an analysis of your posture and look at how your posture is presenting when you're sitting and when you're standing. And we'll take notes and notation to see where you're at so we know where to go with your treatment program. And then last, we'll evaluate your functional activities. These can be as simple as dressing, bathing, doing laundry, any kind of activities of daily living that you're doing at home that you may be having problems with. Then we'll go over if you're employed and your work tasks, things that you may be doing at work, if you're doing heavy lifting, if you're sitting at a computer all day, and we'll do an analysis of where it's at and where that may be affecting your neck and your back problems. Lastly, we look at sports, whether you're doing recreational sports, competitive sports, what type of sport, what type of injuries may be occurring due to that sport, and seeing if we can help change the way you're doing things to reduce the strain on your neck and your back. Next slide. Thank you. All right, a healthy back always requires core and postural strengthening of the spine. Our core muscles are located deep within your trunk, extending from the base of your head down to your pelvis. The Mayo Clinic actually described that there are actually 29 different muscles that are considered part of your core muscles. An example is some of the larger ones would be your glutes, your abdominals, your lats, your traps, and your pecs. And there's many, many small little interspinal muscles that are part of our core. Next, strong core muscles make it easier to do most of our physical activity supporting our spine. And these muscles need to work in symmetry and be balanced. So that's why flexibility as well as strength is really important when we're working with a patient, to see that these muscles are balanced and in symmetry to prevent injuries. Lastly, weak core muscles can leave you susceptible to poor posture, back pain, and muscle injury. Harvard Health warns that weak core muscles can actually leave you more prone to slouching, poor posture, and then of course in the end would be neck pain and back pain along with that. Next. All right, I'd like to go over to discuss 5 reasons why you should strengthen your core muscles. The first one is core exercises, like I said previously, will improve your posture, your balance, and your stability. Second, core exercises don't require you to have a specialized equipment or a gym membership at all. These are exercises you can do with just some free weights, or the majority of them are done just with the resistance from your own body as you're performing them. The third one is, of course, core exercises, which most people think of core exercises are helping to tone your abdominals. But like I said, there's actually 29 different muscles making up your core. Strengthening and toning those underlying abdominal muscles are really like making a corset around your spine so that your spine is well protected when you're doing activities. Number 4 is strong core muscles make it easier to do most physical activities. And when your core is strong and you're swinging your golf club, you're less likely to injure yourself. Or if you're simply tying your shoes, or something as simple as reaching for a glass in the cabinet, by having those strong core muscles, it reduces the chance of hurting yourself or causing more back and neck pain. Lastly, core exercises can help you reach your fitness goals, and like I said, all along is reduce your injury. A well-rounded fitness program always should include some core muscle exercises. And next, on the next slides, I'm going to go over some examples of some core muscles with you, exercises that help to build your core muscles up. The first one in the picture is called a Superman. And this one, if you look, you're lying on your stomach, and you can either lift both your arms and your legs up at the same time, or if that's difficult, we'll have somebody alternate a right arm and left leg, and then the left arm and the right leg to progress with those. That particular exercise will target your lower and upper back muscles and also your glute muscles. The next one are side bends. Maybe you remember these from when you were in gym class. These can be done in standing as shown in the picture. It targets your obliques. And as you see, you're standing, you would be in a T, and then you're going to bend off to the left side, come back straight, and then bend off to the right side again. If it's somebody who's not able to do them in standing, you can modify this and put them down into sitting and work on it that way too. The third one is wood chops. And it actually, if you look at it, that's basically what the exercise is. It's like you're chopping wood. This targets your obliques also, and you're going to go from the right, the right upper corner down to the left, and then you would reverse it, and you can go from the left down to the right, and it's just a chopping motion that you're doing with that particular exercise. Okay, let's continue with number 4 is an exercise called dead bugs. I think Dr. Ben may have mentioned this one. There's a lot of modifications you can do with it, but the basic one will target your upper and lower abdominals. And if you look in the picture, your hips are bent at 90, your knees are at 90, your arms are straight up to the ceiling, and you can lift your head gently up off the table and hold in that position. You would probably hold from 10 seconds to 20 to 30 and build up your strength that way. If you want to make it more difficult, you can alternate your arms and legs when you're doing that one. This one can also be modified in sitting if you wanted to do it seated, if you couldn't get down that way, and do lifting your knees up and down, and you can throw arms into it too. Number 5 is a bridge exercise. That's a really classic exercise, and that one incorporates a lot of your core muscles, being your abs, your glutes, your hip abductors. And if you look, you got to be careful when you're doing it. You don't want to arch your back when you're doing it. You want to pull your core in, make your abs, always say belly button to spine, so you're locking your core in, you're using your glute muscles, and then you're lifting your buttocks up off the table. So you're in a, with your knees bent when you're starting out in this position. And the last one is one of the toughest ones to do, which also can be modified for those that can't get into the position that's in the picture on the right. This targets your entire core, and on this one, you're coming up on your toes, you're weight bearing on your forearms as she is in the position. You want to hold a good 10 to 20 seconds. You can progress that all the way up to a full minute. But if that's too difficult, we'll take somebody down and bring them on their knees and modify it that way to make it a little easier for them. And next. Okay, as in any strengthening program, it should always incorporate and include a really good flexibility and stretching program too. So regularly stretching the muscles, tendons, and ligaments that support the spine is an important element of any back program. Lack of flexibility in the extremities can lead to strain stress on the spine, and keeping these muscles flexible makes you less prone to injury. So usually we focus on hamstrings, we focus on the gastroc, depending on what you need, the low back. Hip flexor is always important to stretch out. So it's really, really crucial that a stretching program is also incorporated along with it. And this concludes my presentation. So I think passing it back over to Caitlin Conville, the nurse practitioner at this time.
Right. Hi, everyone. So I'm back. I'm just going to tell you a little bit about the Back and Neck Pain Center and how our program works. Next slide. All right. So here at the Back and Neck Pain Center, we have what we like to call a stepladder approach. So this graphic depicts our approach to treatment at the Back and Neck Pain Center. With this approach, we aim to provide the least invasive, effective treatment option for your condition. So for most people, this means starting with conservative treatment measures such as physical therapy or chiropractic care. If you've already tried conservative measures without improvement, or if your condition warrants further intervention, we may start a little bit higher on the ladder with interventional pain management or one of our support programs. In cases when you have the red flags, signs or symptoms that we talked about that indicate an urgent condition, we may send you directly to a surgeon. So statistically, approximately 75% of our patients improve with conservative measures, but we continue to evaluate you throughout the course of treatment, and we recommend additional treatments or steps as appropriate. About 20% of our patients utilize our pain management treatment options, and about 5% of our patients have required spinal surgery. So our overall goal is to provide you with the most appropriate treatment and the treatment that will be effective in reducing your pain and will help you to regain function. Next slide. So why choose the Back and Neck Pain Center? So how are we different? Here at the Back and Neck Pain Center, we provide evidence-based multidisciplinary care that's customized by a clinical team, a collaborating physician, and guided by myself, the nurse practitioner. So when I talk about multidisciplinary care, I'm referring to the fact that we have multiple providers from many different disciplines, including spine surgery, interventional pain management, physical therapy, and chiropractic care, who all work together to coordinate your care. So we meet once weekly and we review patient charts to allow for for providers from different backgrounds to weigh in on the selected treatment plan and provide their unique perspectives. So also at the Back and Neck Pain Center, we aim to reduce recurrent episodes of back and neck pain in the future by teaching you about adopting a healthy lifestyle like we're talking about today, diet and exercise habits. Here we also avoid the use of high-risk pain medications. So while one of our goals is to alleviate your pain, we want to find the underlying cause of your pain and provide treatment that really addresses that underlying cause. At the Back and Neck Pain Center, we also identify and address disparity of care factors. So there are many factors that make it difficult for individuals to access treatment, such as financial obstacles, transportation issues, mobility issues, comorbid medical conditions, mental health issues, and just difficulty managing multiple appointments with different providers. So here at the Back and Neck Pain Center, we aim to identify these factors and provide assistance to ensure that you're able to get the treatment that you need. Next slide. All right, so I'm going to pass it back over to Dr. Ben Eliyahu, and he's just going to review the results of your risk assessment with you.
Thank you very much, Caitlin. So this is referring to that tool that we looked at before. So pretty much if you score 2 or higher, that's about a 20% functional disability. So we generally use that as a tool to baseline someone, because that means your problem is affecting your function. And what does function mean? Your activities of daily living, your hobbies, the sports you like to play, gardening, yard work, playing with your children or grandchildren. The point is that it affects your function and it affects your life. So what we do is we use that tool to assess, and then usually if you score 2 or 3 or higher, that means that you really should be seeking someone's help to improve your quality of life. So here at the Back and Neck Pain Center, we accept almost every insurance plan, and we're here to help people. Next slide. So before we go to the conclusion, notice on the bottom there's a Q&A. After I conclude today's webinar, and we're just about done, go ahead and type in any questions you have, and then either myself, Caitlin, or the physical therapist, Susan, will answer the questions appropriate to the type of question you asked. So obviously, in conclusion, adopting a healthy lifestyle is not just good for helping your back and preventing back problems. It's really important for your overall health in general. You know, if you have some BMI issues, walk, lose weight, work on posture, sitting nice and erect. That helps your back not only get better, but also prevents an injury from coming. Caitlin talked about the resources available for quitting smoking. We talked about mood, anxiety, mental health, and the role that plays in perpetuating back problems and even causing back problems. Something as simple as she gave you, the tool of doing the body scan, works really well. It's well researched. It's shown to reduce muscle tightness and blood pressure issues. If you're having a problem, treatment is available at the Back and Neck Pain Center. You don't have to just live with the pain that you have. If you're not responding to things you're doing at home, call us. Recognize when you need to get help. If you're having chronic pain, severe unrelenting pain, or some sort of progressive neurologic deficit such as numbness or weakness, don't sit on that, because the longer you sit on something like that, the longer it can become non-repairable and it can affect and jeopardize your future health. So let's take a look at some of the questions, and go ahead and type some in if you have any. So someone asked about mattresses. That's a great question. So what type of mattress do we recommend? There's lots of good mattresses out there. This really comes down to your personal level of what you think is comfortable. I can tell you that sleeping on your side and sleeping on your back is critically important, but when you do that, your spine should be perfectly aligned so that your back and neck are parallel to the mattress you're sleeping on. So what are some good mattresses? I like Tempur-Pedic. There are other mattresses like Sattva. Tempur-Pedic's another good one. Serta iComfort. I particularly am biased towards the hybrid type mattresses that have either some sort of foam and hybrid coils inside, because they tend to be very supportive. They last longer. Stay away from the mattresses that cost $500 or $400, because, you know, in life, if you haven't learned this yet, you get what you pay for. If you're buying a mattress for $300-400 at Costco, you're getting what you paid for. Even if they call it Sleep Sealy Posturepedic, it doesn't mean anything. Sealy Posturepedic, for example, has probably 30 mattress lines that go from the poorest to the best, yet they're all Sealy Posturepedics. So spend a decent amount of money on a mattress. you know, go look at it at mattress places a couple of times, sleep on it, don't pull the trigger too quickly. And I hope that answered your question. And the same applies to pillows. Make sure that the pillow you're using keeps your neck aligned with your spine. If you're using too fat a pillow and your neck is elevated like this, it's going to cause a problem. If you're using no pillow, and the pillow, your head is here on the bed, now your head is like this, that also is going to cause a problem. So the pillow should take up the same amount of space that keeps your neck in line with your back, nice and straight. And the same for the mattress. Any other questions? Go ahead and type them in. If not, go ahead and try and make some of these lifestyle changes that we spoke about. You know, I think they're really important to, if you don't have any issues with your back, if you do some of the things or most of the things we talked about, it'll keep you out of the doctor's office. If you're already experiencing problems, try and change some of the bad habits, improve your lifestyle from a diet and exercise and activity point of view. And when we talk about exercise, it could just simply mean start walking, start doing some of the things that Susan recommended, some of those easy planks and dead bugs. They're easy to do. Anybody have anything else? Caitlin, Susan, anything you want to add before we terminate our seminar?
No, I don't think so. Just want to thank everybody for tuning in, and hopefully people can implement some of these strategies to have a healthier lifestyle.
Emily, thank you very much for your help running the seminar. You can see on this last slide, if you have any information, email us. There's our phone number, and Emily will send you a copy of the PowerPoint. So all the things that you saw, you'll have as a reference point. Thank you for attending and enjoy the rest of your day.
Yeah, thank you everybody for joining the webinar.
Two more questions came in.
Okay, go ahead.
Never mind. Just people. Everybody have a good day.
All right. Thank you, everybody.
Bye-bye.